Good morning, everybody. Thank you so much to Susan D'Agostino. I'm going to introduce her here. She is a certified mindfulness and meditation instructor. She's a Qigong instructor, and she's also a registered nurse, and she's also a sarcoidosis warrior. And she's here today to begin our 4-week session of wellness and mindfulness and meditation. Welcome, Susan.
Thank you, Mindy. It's great to be here. Good morning, everybody. I'm so excited to be able to do this presentation. Again, I'm just going to do a little short introduction of myself. My name is Susan D'Agostino. I am a registered nurse. I am retired, though, and I did have to retire mostly because of my sarcoid. I retired a few years ago when I was first diagnosed with ocular sarcoid. That's how my sarcoid journey began, and it's traveled a little bit, just like most of you. I also have pulmonary sarcoid, and I probably would have had to have retired anyways with this COVID situation. And so after I retired, but actually way before I retired, I had already began to practice mindfulness and meditation and was on my journey to becoming an instructor. And after I retired, like almost 4 years ago, I became certified, and then I also began to study Qigong and became an instructor. So I'm super delighted to be able to present some of these teachings and how mindfulness meditation for health and well-being overall can help you, but also in and with our diagnosis of sarcoidosis. I have really truly used a lot of what I've studied now to get me through some of these trying times with sarcoid, but also now in the times that we're living in with political climate, with COVID being out there. There's just so much that is so overwhelming to all of us. So I was so thrilled when Mary McGowan, who is the CEO for the Foundation for Sarcoid Research, reached out to me, and we were able to talk about this and bring this program. And with Mindy's help, who is amazing with this Zoom stuff, which is new to me. So I hope you'll all be patient, and I hope you'll really enjoy this presentation. So let's go ahead and get started. The McLean Meditation Institute is an institute based out of California now, although they used to be in Arizona, and that's where I became certified as a mindfulness and meditation instructor using a program called the SEED, which means simple, easy, everyday instruction. So I'm going to utilize some of the things I learned there, and then also some of the things that I've incorporated in mindfulness and meditation. Okay, so let's move on to our first slide. So let's talk a little bit about what mindfulness is. And this is a word that I think everybody is just hearing all the time. Mindfulness, meditation, things like that. So mindfulness is a practice that was brought to the United States in the 70s, really has some Buddhist traditions and some other traditions in the past. It was brought to the United States by a scientist by the name of John Kabat-Zinn. So this is kind of like a great little introduction and a meaning of what mindfulness is. It means maintaining a moment by moment awareness of our thoughts, feelings, our body sensations, and the surrounding environment through a gentle, nurturing lens. And mindfulness is often developed through the practice of meditation. I love this little slide here. It shows is your mind full or are you mindful? And this is a great little slide because it really does show how most of us are. We're on that left side. Our mind is definitely full, and we miss the trees, which are beautiful. It's the only thing that the dog notices are the trees. But look at all the crazy things that we're noticing or mostly thinking of, and our thoughts are going wild instead of really being in the present moment, enjoying the trees, the walk with a dog, and the sun. So it's a great little picture of where most of us are at. So again, like I said, mindfulness is a practice. It really is a way of living more than anything. And we use the tool of meditation much like we do use exercise for physical benefits. So mindfulness basically as you begin to become more mindful, you're using this technique of meditation to learn how to be in present moment and to really be aware of what's going on every single moment. Obviously, that doesn't always work. You know, we try to live a mindful life as much as we can. And the practice is exactly that. It's a practice. It's something we do over and over and over till we're able to utilize this practice more and more so every day. You'll never be 100% mindful, but the more you use this mindfulness practice and you use meditation as one technique to practice mindfulness, you begin to feel more of a calm and just really a basic lessening of anxiety and fears in your daily life. And as we go through this 4-part series, you guys are going to start noticing some things happening and some shifts. And I'm going to give you some homework to do on a daily basis. Very simple little techniques to use daily, but we're gonna go through those techniques through this series. And at each class, we'll give you a little bit of homework to do at home and see how that begins to shift your life and maybe shift the way you begin to go through your daily life using mindfulness. So what I'd like to do at this point is I'm going to stop the video of me and I'm going to put the next video, which is a picture, and we're going to practice something called a mindful moment. I'm going to try to see if I can get my dog not to bark. She is a Jack Russell, but we'll use that as a sort of a distraction if it happens, and we'll practice mindfulness with that little bit of a distraction. So we'll go on to the next slide, and I'll have this slide here as a visual, and I'm going to take myself off the screen, stop the video of me, and we'll use this to begin our mindful moment practice. And this is a practice that you can use all the time. I mean, this is a practice that you use at any moment of your day, and you'll see why this is so simple in a couple of minutes. So we're going to set our intention here, and we set the intention here, and we should set our intention actually for all these classes that will be present. We'll take the time to be here for 1 hour or 1 hour and 15 minutes and try to remove as much distractions as we can in our daily life. So I'm going to invite all of you to close your eyes for a moment. Hopefully you're sitting in a comfortable chair. Sitting in a comfortable chair is preferable versus laying down in bed or laying down on a couch, just so that you're a little bit more aware and awake. But if you need to lay down, that's also okay. So I invite you to either close your eyes for a moment or to gaze softly at the screen or gaze softly toward the floor. At some point as you practice this, you will probably close your eyes and that would help you through this. So close your eyes or gaze at the screen or gaze at the floor at this moment and take a long, slow, deep inhale through your nose. And then let it out slowly through your nose again. So I'd like you to continue to do that, taking a long, slow, deep breath. And then again, a long, slow exhale. I'd like you to bring your attention to the sensation of the inhale and the exhale. Let your breath return to its natural rhythm and depth. Or if you're comfortable with a deep, slow inhale and exhale, continue to do so. Whichever way feels comfortable for you. Now, this is what we call a mindful breath. What we're doing here is just paying attention to the breath and having an awareness to the breath. Now you can slowly open your eyes. How do you feel right now? This is something all of us do, obviously, every second of the day, every millisecond of the day we breathe. This may be the first time you've ever really paid attention to your breath. My dog is in the background barking, so there's your distraction and mindfulness. I'm going to try and get her to stop. She's a Jack Russell, so getting her to stop and do anything is really difficult. All righty. Okay, everyone. So let's move on to the next slide. Okay. Okay, if I can get to the next slide. So here we're going to talk a little bit about what is meditation. Like I said, meditation is a tool that we use to become more mindful, and it's also a tool we use for a lot of other things. So meditation is basically a technique for quieting the mind and the nervous system. Again, it's a practice for training the brain to be more focused with a non-judgmental awareness, and it's also a natural state of deep rest. And there's a couple of things we're going to talk about here. When we talk about non-judgmental awareness, so as we were doing that mindful moment, it's what we call a breath awareness practice. Some of you may have noticed, your mind went to thoughts. Maybe you were thinking about, oh, what do I need to do today? What chores do I have on my list today? A lot of thoughts are just happening. The mind never stops. I mean, once your mind stops, obviously, then that's a problem. So we know that when we begin to meditate or we begin to practice mindfulness, we begin to notice this awareness of, wow, the incredible number of thoughts that we have constantly going on in our minds. So what do you do with those thoughts? And we'll learn what we do with those thoughts in meditation as we go through this series. So basically, it's like, let's say you were doing that mindful moment and you had your eyes closed and you were paying attention to that breath and feeling the awareness of the breath, how it, you felt when you took a deep breath in and then you exhaled and you felt the exhalation, but then your mind went to, oh, I need to go grocery shopping today. So what do you do with that thought? So at that moment, that's what breath awareness is all about. We begin to come back to the breath. You basically let the thought float away, or you just become aware, oh, I had that thought. It's okay to have that thought, but then you come back to the breath. So that's what a breath awareness practice is. And we don't judge a thought. We don't say, oh my God, what a crazy thought. I shouldn't be thinking those things, or putting a label to your thought. You're just saying it's a thought. That's it. So we can use this practice a lot as we go through our journey of sarcoid, also when we have anxiety, when we have fears, when we have pain, when we have nervousness about our diagnosis. We start saying it's okay to have those thoughts instead of judging them. And this becomes a really nice practice because you move away from judgment to just acceptance. And that's part of what mindfulness is. And then really important is this natural state of deep breath. Now, we do know, and John Kabat-Zinn has done a lot of studies in Boston, and he's really the guy who brought the term mindfulness to the United States. And through the last 30 or 40 years, he's done a lot of research on mindfulness. And what he has taught us, and obviously there's a lot of researchers now also doing mindfulness research, but what we have learned through many of the science that he's done and through many studies, actually research oriented and published studies, is that mindfulness and meditation changes the brain. And this is truly, really a very interesting concept. And what he has found over the last 40 years, it takes about 8 weeks of daily practice of meditation to begin to see actual changes in the brain. And we're going to talk a lot about that later on in one of the series, a term called neuroplasticity. So there's so many benefits of meditation, and the practice that we're primarily going to be focused on in this series is the practice of sitting meditation, breath awareness, and a little bit of Qigong, because I am also a Qigong instructor, and we'll use some Qigong with mindfulness meditation to do some breathing practices that would help many of us, not only in meditation, but for those of us that have pulmonary sarcoid as a diagnosis. So we're going to move to the next slide. And why do people meditate? So there are many reasons to meditate. So these are a few of them. So we do know, and like I said, with mindfulness and meditation, we do have scientific research and evidence that shows that mindfulness does activate the healing response, and it does prevent disease. And the healing response is something that really has always interested me as a nurse, this what we call the mind-body connection. And we'll talk quite a bit about that and in mindfulness and meditation. We'll learn people meditate because they want to learn how to focus and to be less distracted and to relieve insomnia and improve sleep. What truly is known, and this is a very interesting concept that we know, is the number one way to reduce stress. And it really kind of surprised me when I heard this the first time many, many years ago. What is the number one way to reduce stress? And it is sleep. It's amazing. And yet we know that sleep is really one of those things that we all struggle with. So when we learn to conquer this stress and we begin to sleep better, we really are doing like a tremendous good for our own bodies, not to mention our mind. So a meditation actually will help you improve your sleep. And there are many techniques that we can use. And primarily one big one that we use in meditation is called the body scan meditation, which we'll also do a little bit of that in one of our series. People use meditation to feel calm, to feel relaxed, to feel, believe it or not, more energized. And when you're in meditation, you may not exactly feel energized because you're so calm. Your body is truly for the first time feeling less stress, maybe feeling more relaxed. But then you'll notice as the more you meditate, the more energized you are because you are less stressed. And we know that stress can reduce our energy levels. So that is one of the keys of trying to meditate on a daily basis. Also, as you learn to meditate more and really calm the body, calm the mind, you begin to notice you have better focus. And with better focus, you become more productive. Possibly if you have a creative bone in your body, which I'm not a very creative person, but many of us are, you become more creative. And it does enhance sports performance. There's actually this is interesting, a lot of studies on sports performance now. And a lot of football teams, a lot of basketball teams now, and even in the United States Olympics and worldwide, actually in worldwide Olympics, they are using meditation and mindful breaths and mindful moments before a performance, like a gymnast or football players before they get on the field. So there's a lot of great research and studies on mindfulness and meditation and just using that breath awareness practice to increase and to actually improve your life, some of the life things that you need to do daily. But sleep is a really, really important one. And I can't stress how meditation over time will really help you improve your sleep patterns and decrease your stress. Okay, so on to the next slide. So what are some of the misconceptions of meditation? And I love this little slide here. It's super cute. I used to have my hair a little bit longer. With sarcoid, a lot of you have suffered this, and some of the meds that you're on, you've had some hair loss, which I've had. I used to have my hair a little bit longer, like I said, and people used to tell me, oh, it looks like you in that slide. So I always use it for that reason. But I love this slide because it really does show what the beginner meditator is like. You're in your meditation pose. You don't necessarily have to be cross-legged. I rarely meditate this way. I'm usually in a chair, feet on the floor, hands on my lap, and we'll talk about meditation poses a little bit more also. But this is perfect. This is your mind going, am I in the moment? Am I doing this right? Boy, I'm really hungry. Oh, my kids need to go to the park or whatever's going on. And really you're not meditating. So this is typical of a beginning meditator, and it's okay. We go back to that non-judgmental awareness. So we start paying attention to our thoughts, and we begin to realize, oh my goodness, my thoughts are like constant all the time. And you begin to figure out like why this is really affecting your life. So these are just some of the misconceptions of meditation. I can't stop thinking. It's too difficult. I can't do this. I'm too busy. Uh, I'm getting so relaxed, I just fall asleep. And that's an interesting one too. It makes me fall asleep. And that's very common for people who are beginning meditators. They fall asleep. It may be the first time your body has been this relaxed when you truly begin to meditate, and that's why you fall asleep. And that's okay also. It's not part of my religion. People, will see you in this pose, or you think about it and you see yourself in this pose and you say, well, how does this conflict with my religion? And, meditation is a religion, which it is not. Meditation is basically a practice. And a lot of people pray during meditation, which is also fine too. And there's a whole meditation practice related to prayer. So there is really no conflict between religion and meditation. And then again, the I can't sit cross-legged issue. Again, like I said, I don't rarely sit cross-legged. I'm getting a little bit older for that, and it's harder to get up off the floor. But sitting in a comfortable position in a comfortable chair, feet on the ground, hands on your lap is usually a very nice way to practice or to begin a meditation practice. If you do yoga, a lot of people will practice yoga with meditation, and that's also a really good practice, because then you're incorporating exercise with meditation. So that's also a nice practice. But this is a great little pictorial about how some of you who are just starting meditation may feel at the very beginning. And again, we go back to that whole concept of not judging your thoughts and not being so hard on yourself if you can't do it right. When I first began practicing meditation many, many years ago, the goal was basically the breath awareness, becoming aware of the breath. And that's why we always start with a breath awareness practice and just really being familiar with what the breath is, what it feels like to breathe. Sometimes I would probably say most of you have never thought of this. What is a breath? What does it really feel like to breathe? Paying attention to what a breath is, what a gift breathing is. Some of us probably know that better than others, but it is a gift no matter what, no matter if you're on oxygen, no matter if you're not, no matter if you have sarcoid, no matter if you don't, breathing is a gift. And so for the first time, we might start to really become aware of what a great gift this is. Okay. Some other thoughts are that, things are, like, basically, I should have probably put these up as I went along, but it's okay. We've gone through most of the thoughts are normal. Like I said, all of us were thinking all the time. So that's okay. When we learn to not necessarily control, because what we're doing is not controlling our thoughts. We're beginning to accept our thoughts and become non-judgmental of them, and possibly not let our thoughts take away from present moment awareness. That's what we want to do with mindfulness and meditation. So like when you begin meditation, you want to start with a very low goal. Maybe you start with breath awareness practice like we just did. And that's a homework that I really want to assign to everyone when we leave at the end of this session, but we'll talk about that at the end. So we'll start with a breath awareness practice. Maybe we move to 5 minutes daily or 3 times a week. It's sort of like exercise. You want to move to 5 to 7 times a week because you're going to get the best benefits from it. You will feel clearer. You will feel more responsive. And then again, like I said, it's not a religion, so there's really not a need to change your belief system. And any comfortable sitting position, in a comfortable chair, obviously, at the beginning is probably the best position there is. Now, there are many benefits to meditation, and we primarily will be looking at physical, emotional, and mental. And over this series, every Saturday as we go through this, we'll look at on one of the series, we'll look at the physical and concentrate on that one. We'll begin to incorporate some Qigong practices there. And then we'll look in the next series of the emotional, and then the mental aspects and benefits of meditation. So what we're trying to do is create a wellness or a wholeness to our being, to our human lives, to our bodies. So we're going to incorporate the mind, body, spirit. And again, like I said, as a nurse, I found this like such an intriguing concept with patients, because as a patient, we are very aware of possibly our diagnosis, and we've spent hours on Google, looking up sarcoid, and so we've become sort of experts. Some of us are more experts than some of our physicians on what sarcoidosis is. But we've never really incorporated this knowledge that we have, because we have a tremendous amount of knowledge of sarcoid, into how it's really affecting our spirits and our minds. So we need to merge this knowledge so that we're able to better bring together our mind, body, spirit connection, and be able to go through this process of meditation in order to be able to use this as a positive in our diagnosis, and maybe helping us deal with this diagnosis in a better way. So we'll briefly go through these slides, and like I said, in each of the next sessions, we'll talk more in depth about the benefits of each one of these. So with some of the physical benefits of mindfulness and meditation are reducing your levels of stress hormones, the cortisol and adrenaline, normalizing blood pressure, lowering cholesterol, reducing fatigue and increasing your energy, releasing some of the chronic physical conditions that we live with, such as pain. A lot of us suffer from GI problems. Again, like I said before, stress is huge in insomnia. We learned that sleep disorders are very big, especially even with sarcoid. So we learn how to increase our sleep patterns so that we're able to deal more with stress and insomnia. Some more physical benefits include releasing endorphins, increasing DHEA, and optimizing our immune system, which obviously is extremely important in dealing with sarcoid, which is considered an immune-mediated response to a factor that really no one knows what it is. Not so much an autoimmune disorder, but really a response to something. So we learn to use mindfulness and meditation to basically calm the immune system and possibly help in our recovery, help in our daily living with sarcoid. So these are some of the physical benefits very quickly. And in the physical benefits portion of this series, we'll go through each one of these individually and in depth. So here's another great little slide. What fits your busy schedule better, meditating 30 minutes a day or being dead 24 hours a day? Kind of a little bit graphic there, but wouldn't it be awesome if your physicians really talked about this a little bit more? Stress management, using meditation as one technique, Qigong, yoga, exercise. There are many ways. There are hundreds of ways really to become more mindful. Using the practice of mindfulness, meditation is one that we're going to be talking about throughout this series. I mean, I always love that the doctor has a prescription in hand, and wouldn't that be great if he gave a prescription on meditating? And when I was working at the last job I had, I was really a manager over a cardiac rehab center, pretty big one in here in South Florida. And we really did get a lot of our physicians on board for using stress management techniques. And I was actually teaching some mindfulness and meditation at the hospital for our patients that had open heart surgery and other types of cardiovascular disease. So I think that physicians are becoming more aware of this. And I was on the summit this weekend. I actually did see a couple of the physicians talk about this. So I was I was thrilled that they talked about it, and that the FSR reached out and wanted this series. And I think this is a great project for FSR to have, and for all of us to be involved with. So again, I'm thrilled to do this. I'm thrilled to have everybody here, and the interest is amazing, and I just love it, and I'm so happy that we're able to do this and spend this time together. So there we go. So what are some of the mental benefits? Increasing neuroplasticity. Neuroplasticity, excuse me, is such an unbelievable concept, and so much being studied right now by neuroscientists throughout the world. We actually have a very big center here at the University of Miami studying neuroplasticity with physicians and in the community, and we'll talk a lot about that when we do the seminar on mental benefits. Neuroplasticity actually means changes in the brain that occurred during meditation, and there are some amazing results, and I think all of you are going to be like so thrilled when you hear about this. So increasing attention span and the ability to focus, increasing your self-awareness, self-compassion, self-confidence, and improving your memory and enhancing creativity, which goes along with the term of neuroplasticity. Self-compassion is also a tremendous thing that we all need to learn and utilize in our daily lives. We can be so rough on ourselves, especially when you have a disease like sarcoid, and we need to bring self-compassion to ourselves. And we'll do some meditation practices that have to do with compassion for yourself, and in being compassionate to yourself, you become more compassionate to others. Self-awareness is the concept in and of itself is what mindfulness is, becoming awareness of your breath, of your body, your thoughts. So these are all concepts that we'll talk about as we go through this series. And here are some of the emotional aspects of what we do with mindfulness and meditation, and some of the benefits that we create. We create a greater sense of inner peace when we begin to be more mindful, when we begin to be more compassionate, self-aware, non-judgmental. You begin to create this sense of inner peace for yourself. You create better control over your own emotions. You're more calm. You decrease your nervousness, fear, anxiety. You get really a better and more optimistic outlook on life. All of us with sarcoid deal with anxiety and fears. Fear of what's going on now, fear of what brought you to your sarcoid diagnosis, the unknowns of sarcoid, the anxiety of what your future may hold with sarcoid. I know when I was initially diagnosed over 5 years ago, the anxiety was tremendous. It was tremendous. And then as I go through this journey, first it started with my eyes, then my lungs, and then, some lesions now in my liver. So it's really a journey that most of us have that is really so stressful, and being in a constant state of fear and anxiety is really not going to help in the long run. And that's something I truly did find out over time, that as much as I meditated and practiced mindfulness, I still had a lot of anxiety. So I had to work a little bit harder, especially on some of these emotional aspects of having sarcoid, which I'm sure most of everybody on this webinar can relate to. So what are some of the requirements of meditation that we'll ask you to look at over the next 3 series? Obviously, you have to have a willingness to do it. And I think if you didn't have that, you wouldn't be here. So congratulate yourself on that one. And then we take that a little bit further, and the resolve to do it. That means to make it a daily practice. And when I say make it a daily practice, I don't mean after this seminar today, you should be doing this 7 days a week, but the resolve should be there, the intention that, yes, this is going to become part of my life. And we'll do that slowly. Maybe today, like I said, we'll just utilize that mindful moment practice as much as we can in our daily life. When you feel stress, when you feel like anxiety, when you feel fear, whatever you're feeling, when you're at the doctor's office, you're sitting in that chair and you know your blood pressure is rising. And this happens to me all the time. I have white coat syndrome, which most of us probably have. You take that deep breath, you close your eyes, you go back to that breath awareness practice, try to let the thoughts float away in a cloud, or use whatever techniques you have to use to come back to the practice of the breath. And you'd be surprised at how much your blood pressure will go down. So that's the resolve of saying, okay, these practices really work and I need to utilize them. Again, another requirement of meditation is that non-judgmental, gentle attention. As you start to have all those thoughts in meditation, don't judge them. Judging the thoughts means you're judging yourself. So you want to break away from that and just give it a label. Okay, the thought might be, okay, anxiety. I have anxiety. Okay, come back to the breath. Or I'm really nervous, or I'm really fearful, or whatever the thought may be at that moment. Acknowledge the thought. It's okay to have the thought. Don't punish yourself with the thought. You want to come back to that breath and just accept the thought. And then a focus for your attention. And the focus is, we always start with the breath. Obviously a lot of people, as they get better at meditation, they may want to have a picture. They use a mantra like or a sound, or even music, the ocean. So your focus can change. And I use a lot of different focuses, and we'll talk a little bit about different focuses for attention. But the breath is probably the most important practice that you'll learn in meditation, and that's the one we always begin with. And so what are some of the 5 essentials of meditation? And this is something we learn at the McLean Meditation Institute, that all of us have. It's okay to have thoughts. You don't want to try too hard. You want to start slow, move your way forward. In meditation, begin with a couple minutes. Maybe you're going to get really good after a couple of months, and you're going to need 20 minutes. All of us work at a different pace. Don't try too hard. Again, this is where the concept of self-compassion comes in. You might say, oh, I'm not meditating right. I'm not doing this right. I can't, my thoughts don't go away. Again, you're being really hard on yourself. Let go of that thought. You don't need to be hard on yourself. You just accept it for what it is. And each meditation session, believe it or not, you could be meditating for the rest of your life, and each meditation session is going to feel different. So you let go of those expectations of what it should be and accept it for what it is. Be kind to yourself, again, going back to the concept of compassion, and sticking with the practice. When John Kabat-Zinn in Boston started studying mindfulness and meditation, he started, research. He started doing different practices. He started testing people with their blood pressure, with doing something called functional MRIs to see changes in the brain. And what they have found is that a daily practice over 8 weeks will create changes in the brain. That's part of the concept of neuroplasticity, which is such an amazing thing. And when I begin to talk about this, when we talk about neuroplasticity, you guys will really see why a daily practice consistently is so important over time, and probably for the rest of your life. And it truly does create physical changes, the spiritual changes, the body changes, and all the changes that are going to benefit you as you go through your sarcoid diagnosis and whatever may happen, or has happened, or is happening, or is going to happen in the future. So what I'd like to do is spend a few minutes here, and we're going to move a little bit past the mindful moment breath, and we're going to do a little bit of a practice here, maybe 5 or 10 minutes, and then we'll come out of the practice, and we'll talk a little bit more, and then we'll wrap up the session. So I'm going to take myself off the screen and just let you guys look at this picture as we begin. And we're going to begin to meditate. We're going to try and do this for 5 or 10 minutes. So at any time during the meditation, if you feel like you need to move, make yourself comfortable. The thing is to be comfortable in meditation. Now, I don't want you to get up off your chair and go into the kitchen. So, I'll give everybody a minute or so here while I talk. If you need to get a glass of water, drink some water, reshift your chair, move into a different part of the house. Tell whoever is in the household with you to give you 10 minutes now of quiet time, setting your intention to be here for 10 minutes and giving yourself this gift of this meditation practice. So we'll just give ourselves a minute here, and everybody just maybe have a sip of water. Reshift yourself in the chair. Kind of take a mindful moment breath. And you can do that with your eyes right now and just pay attention to your breath. Keep your eyes open right now and just take that mindful moment breath. Breathe in, breathe out. As you breathe in, just really feel the breath. Feel the coolness of the room maybe. As you breathe out, you feel the breath a little warmer. You feel the movement of the chest rising and falling. Maybe you feel the belly moving. You may want to put your hand on your stomach or on your chest and feel the movement of the chest rising or your belly moving as you breathe in and out. That may have been something that you've never done. Have you ever really paid attention to how the chest rises and falls? What the belly feels like? Okay, so let's begin our meditation practice here, and hopefully you've told everyone in your household to give you 10 minutes of peace so you can concentrate on yourself. You've set your attention to be here, to be in present moment, to be aware of your body and how it feels, the breath and how it feels, and possibly for the first time, really truly meditate. And remember, like I said, there's no right way, no wrong way. If you have thoughts, just come back to the breath, and I'll instruct you as we go through. Being comfortable is extremely important. Maybe placing your feet on the ground, hands on your lap, if you can. Okay, so here we go. Sitting in your chair, allow your body to become still. Your back is straight without being stiff. Your posture is relaxed. Posture is awake, and you feel dignified. Your hands can rest gently on your knees or in the lap. Your eyes may be open or closed at this moment. Simply resting on the gaze on the computer, or simply resting with your eyes gazed to the floor or to your lap. At some point, maybe you'll close your eyes. That would be best. But if you can't, that's okay. Don't think too much about what you're viewing. If you are looking at the screen, just come back to the breath. Bring yourself to an awareness of the breath. So as you're settling into this moment, you begin watching the breath. You begin feeling the breath. You become aware of the fact that you're breathing. Become aware of the movement of the breath as it flows into and out of your body. Feel the breath as it comes into the body and as it leaves the body. Simply remain aware of the breath flowing in and flowing out, not manipulating the breath or the breathing in any way. Simply being aware of it and noticing how it feels. When your mind becomes distracted, and it will become distracted, simply return to the breath. No commentary, no judgment. Allow yourself to be with this flow of breath coming in and coming out. Notice the feeling of the breath as the lungs begin to fill with air on the in-breath and deflate as you breathe out, the chest expanding and collapsing. Perhaps you're feeling the breath in the abdomen, rising as you breathe in and flattening and sinking as you breathe out. Allow your attention to gently ride on the sensation of each breath, not thinking about breathing without the need to comment, simply watching and feeling the breath. Allow the breath to naturally breathe itself, not needing to change it in any way, giving full attention to each breath. Observe the full cycle of each breath. Locate the beginning of the breath as it enters the nose or mouth, and follow it as it fills the lungs, expands the chest and the abdomen, then comes to the gap where there is neither in-breath nor out-breath before it turns around and makes its journey out of the body. So we want to breathe in, hold the breath, and breathe out fully as much as you can. Remain present for the cycle of each breath, being there, letting your attention gently float on the awareness of your breath. If at any time your mind begins to wander, you begin to have thoughts about the past, the present, the future, just come back to the breath. Breathe in and breathe out. Do this each time a thought comes to mind or any distraction. Come back to the breath. Breathe in and breathe out. Simply come back to this breath. Once again, bringing the attention to this breath in this moment. Breathing in with the in breath, breathing out with the out breath. Feeling the movement in your body, the breath anchoring the attention to this moment. And now for the time remaining, let go of all particular objects of attention, allowing yourself to simply be here, simply present. Breath moving, sensations in the body, sounds, thoughts, all of it coming and going, allowing all of it and dropping into being, into stillness, present with it all as it unfolds. When the mind wanders, bring your attention back to the breath, knowing that you can always use the awareness of your breath to refocus your attention, to return to the present. For a couple of moments, we're going to remain silent and again, focus on the breath, breathing in and breathing out. Continue to breathe in and breathe out. Keep your eyes closed at this time and pay attention to the breath, the stillness of the body. Have an awareness of how you feel at this moment. Continue to breathe in and breathe out. In a moment, I'll ask you to open your eyes, but maintain them closed right now. Continue to breathe in and breathe out. I'd like you to slowly open your eyes and remain in stillness. As you open your eyes, you're going to become aware of your surroundings, your body, how it feels, the breath. Maybe begin to start to shift a little bit in your chair. So for those of you who made it through here, this is your first meditation practice. I'd like you to just spend a moment and just kind of feel the awareness of how your body feels, maybe your mind. You might want to say to yourself, well, how did that feel? And think about that. Again, we don't want to judge. We just want to just say, wow, it felt good. Maybe it wasn't as good as I thought it would be. maybe this is something I could do every day, for 5 minutes. Okay, so that was really a very beginner's meditation. I hope all of you enjoyed that. I hope that's something that you can work on at home. In the series, I'm going to give you some resources. There are a lot of apps that you can put on your phone. Insight Timer is a really good one. When I first began to meditate, I needed someone to help me, meditate, use guided meditations or visualizations. So that might be something that you'll need at the beginning. I've been meditating for so many years now that it's very easy for me to just sit for 20 or 30 minutes and meditate, but that's usually not how it is at the very beginning for most people, and that's okay. I did that for probably a year. I was, and occasionally I'll still go on there and on Insight Timer. I really like it. Insight Timer is one of many. Calm is another one. There's so many apps out there that you can use if you require that for sitting meditation. And again, like I said, there are many types of meditation. For myself personally, I use sitting, I use walking, I use grounding, I use yoga. I find the variety for me much, much better. And I think people do a lot of experimenting with meditation over time, and they figure out what's better for them, or which ones are better for them. For me, it ended up being a series of different types of meditation techniques. Like, it's, again, like I said, it's like a lot like exercise. Some people love the treadmill, they love the bike, they love the elliptical, whatever techniques, or they go to the gym and they use a variety of equipment. So I always try to talk about meditation with exercise as an analogy, because it's a pretty good one. So that really kind of wraps up this session. Like I said, this is going to be a 4-part series. We'll talk in each series about the physical, the emotional, and the mental benefits. I'm going to bring in some Qigong practices during the physical benefits series. We'll talk a lot about all the meditation techniques that are out there. On the next series on November 28th, you guys will have an opportunity for some questions and answers. And I always love that part, because people have such great questions, and usually it stirs my mind to look things up and really to even get me more involved with some of the things that people are practicing out there or have questions about. I just want to talk a little bit for a couple minutes, about the 6 pillars of health. And this is an interesting thing that we incorporate in our series. And this 6 pillars of health, and a lot of people talk about the pillars of health and they talk about different things, but for me, they ended up being nutrition, exercise as a movement exercise, which would include Qigong, yoga, walking, stress management, which includes meditation, and sleep, which is very important. Mental health benefits of that's so important in your health, whether it's therapy or you're just having good communications with your partner in order to avoid depression and some of the other issues that deal with diminished mental health. And then also there's a new thing, and I think maybe some of you might be interested in a concept called grounding, which uses the biological rhythms of the body to connect to the earth, which is now being talked of a lot with pillars of health. And in Qigong practice, many people bring the concept of grounding into Qigong, which is amazing, which means you doing Qigong on the sand or on the ground or on the dirt. So you're also connecting to the earth using a exercise or movement type practice. So I hope everybody really loved this session. I really enjoyed doing it. I look forward to the series and to seeing everybody next Saturday and having some great question and answers at the end. So thank you for for being here. This has been wonderful.
Thank you so much, Susan. I hope everybody had such a great time. I was enjoying your session immensely. I feel blissed out. So I hope everybody's feeling as good as I'm feeling. And again, we will be back with Susan next Saturday on November 28th at 10 a.m. Central Time. So that's 11 a.m. Eastern Time and 8 a.m. Pacific Time. And hopefully everyone will be ready to dig in with Susan and do some more meditation and mindfulness after the busy Thanksgiving holiday. So thank you,
And there's
everybody.
just because you say it's Thanksgiving, mindful meditation especially can be used for digestion, because there's a whole concept called mindful eating that a lot of us suffer from digestive problems, and stress obviously a lot of times comes into the gut. So maybe we'll do a mindful eating practice somewhere along the line, which is a very simple practice. I think people will really enjoy that. Actually, I'm going to write that down so I incorporated it, because it's a really fun practice. And if you have kids, you can do it with your kids, which is really a lot of fun.
That's fantastic.
Thank you.
Awesome. Well, thank you so much and have a great rest of your week. And everybody who joined us today, have a great rest of your week, and we will see you next Saturday.
Thank you, Mindy. Thank you, everyone. Bye-bye.